Hello and welcome to our first Wine and Cheese segment of 2021. My name is Sheila Wilson. I'm a nurse and I'm president of Stop Healthcare Violence. I'm also the host of Wine and Cheese on Passionate World Talk Radio. Before I introduce my guests, I want to thank Lillian Caldwell, CEO of Passionate World Talk Radio, and Jeanne White, station manager, for having us come on. My guests tonight are Beckett. And this young lady is a nurse, and she works nights, which really deserves a crown. Beckett has worked the whole pandemic, and I would think that she is exhausted. So I'm going to start saying hello to her and welcome. How are you, Beckett?
Hi, Sheila. Thanks for having me. I am well.
And
I have remained COVID-free. I can't complain. I've remained COVID-free this entire time. And I just got my second vaccination, actually.
And no problems with it?
A little GI upset for about 12 hours, but as I tell everybody, I'd rather have GI upset for 24 hours than be intubated and have COVID. So.
Oh, I know.
It's a better handoff. I'll take the cons of a little nausea and an upset belly versus not being able to breathe.
Right. And there's so much conversation and confusion about the vaccine. You know, you see all sorts of different things on Facebook and LinkedIn and all of those things on the social networks that you wonder, you think the vaccine is safe?
I feel safer. I'm not going to be totally 100%. I'm now protected, and we all know that nothing has 100% efficiency. Is 100% efficient.
Right.
I'm still going to continue to wear my PPE. I'm still going to be wearing my face shield. I'm still going to be gowning and gloving. But do I feel like I have maybe a little bit more protection in my toolkit? Yes. Do I think it's perfect? Probably not. It's just like the flu. Every year we get our flu vaccine, and, every year somebody gets the flu on the flu vaccine because it's not 100%.
Right.
So I'm not going to go, I can battle COVID and not put on my my armor. That would be like a knight going in and just going, yeah, I can protect myself. You just don't do it. You still wear your gear.
Right. Now, you have been working this pandemic since March?
Yep. Yes, I have.
So tell me, how is the PPE doing, and what is happening to you and all of the other nurses there? And your assistants and everybody else, the radiologists, therapists, stuff like that. Any changes? Is it getting any better, or is it getting worse?
From what management has said, it's getting better, but at the same time, they're also, they're very, they say they have to preserve their resources. And instead of allowing all staff in the hospital wear N95s, which I believe should be the case, everybody gets the little blue surgical mask, which is not protective against the COVID-19. And you just don't know who's going to have it. Honestly, you're walking through the building, you don't know who has it, who's transmitting it. If they have a little blue mask, they're coughing, they're spreading it still. Everybody should have an N95 on in the hospital as far as I'm concerned. The fact that they're not following that policy, and I know that other facilities are, I think is absolutely ridiculous. And it's just putting staff at risk. We've seen our numbers of COVID-positive employees have elevated. And then we're in downtown Worcester. I work in an emergency room at St. Vincent's in downtown Worcester, and, Worcester's been blowing up in the numbers lately. We just keep climbing and climbing here in Massachusetts. And, as I said, vaccine's not 100%. They're even saying it's, 94 to 95%. So do I trust that I'm not going to be in that 4 to 5%? Absolutely not.
Right.
And nor should anybody. I mean, until we have this kind of better controlled, we have to continue doing what we know works, which is washing your hands, maintaining your social distance, wearing your mask, and try to help us help you.
Right. And what do you think is happening? Why are the numbers gone up again? Do you think it's the holidays?
I don't think it's just
people are tired.
I think it's not just the holidays. So, we had people start to work. We had people, schools start back. So in the fall, we had all these things start to happen again. We started opening up the public more again. And people, I think, got really lax because they saw the numbers coming down. And they thought, oh, okay, I can take off my mask. I can go to my friend's party and celebrate their kid's birthday, and none of us have to be wearing masks. I'm not physically sick. You're not physically sick, but they keep forgetting that there's the asymptomatic carriers. And, I can't tell you how many cases here in the beginning that we would have a patient in the hallway for something like they hurt their knee, or they had a cellulitis in the leg, or they were a simple fall, something that had nothing to do with the signs and symptoms of COVID whatsoever, and then we're admitting them because of what they had, which was emergent, and why they were in the emergency department to begin with. And now, because we're finally swabbing everybody who's getting admitted, we're finding that these people are positive for COVID, even though they're totally asymptomatic, and that's not what brought them to the emergency room to begin with. So now you've had that person who feels fine, who's out in the public, who's, they're going and seeing their family and friends again, because we've missed our family and friends. We're social creatures. So I think our guard got let down, and the fox got back in the hen house. And, and it everybody's, numbers are climbing in deaths again, and infection rates, and unfortunately, and then you had the holidays, and I think everybody's at the point where they're just burnt out. And not only that, but, I've had people say, well, herd immunity and this and that, and I think we also still live in such a selfish society that it's the me first mentality. I don't feel like wearing a mask. Oh, well, selection, the survival of the fittest. That, and they just think that, well, I won't get it. I won't be the one to die. I won't be the one to get sick. I won't be the one to transmit it. And they don't think about the people they're bringing it to. Right.
And you think this is a younger group, 30s, 20s?
I think I don't. I hate to say it. I don't think it's just the 30s, the 20s. I think there's unfortunately our society and respect for each other has been, and it's a matter of respect. And I don't think that just is in one generation. Unfortunately, that thought process, and it's flawed. It's a flawed thought process, and they might not think they get it, and their immune system's great, but then they went to Christmas and they saw Grandma.
Yeah, Grandma's
immune system. Yeah, and then 2 weeks later she's in the hospital, and they try to figure out how they got it. Well, they only went to Thanksgiving dinner. They only went to Christmas, or swapped gifts, and now you're the one that unfortunately put Grandma in the hospital because you didn't keep your mask on 2 weeks before when you went to your friend's house to have a beer.
Right. Absolutely.
You're tired of being home by yourself. You're tired of wearing a mask. And I don't think we're impressing again. You need to hand wash. You need to hand sanitize. I mean, my hands are cracked on the sides from the amount of hand washing I've been doing. There would be absolutely pointless right now with how bad my cuticles are from the sanitizer to actually even get a manicure. they're just torn up, and the same with my face. You know, I just got done doing 6 12-hour shifts and in a row because, you know, we're also in the middle of negotiations at St. Vincent's.
And how is that going?
Contract. It is not going smoothly. So we started in September of 2019, and we're still in negotiations. We had to stop for a little bit because of COVID. Now we're doing it actually through the mediator, and they have a system called Ring Central, Ring Central, which is kind of cool actually. So we have a main meeting room just like you would if you're having negotiations, and then you caucus, and they actually move you off into your own separate rooms. In this meeting, like in this virtual meeting. So it's kind of similar to Zoom, but the off.
It's what? You're breaking up, Beckett.
Oh, I'm sorry. Can you hear me better?
Yourself? Yes.
All right. So the federal mediator was actually asked to step in by the hospital 2 weeks ago, and has been trying to mediate between the two of us. But they're not making any they won't even talk about staffing, which is one of our bigger points. They won't talk about safety, which, you know, we've discussed that in past conversations about how unsafe our location and the fact that they have nothing in place. Luckily, we just got a new security director. I think he started last week. So he's been there about a week now, a little over a week. And I met him 1 week ago, and he seems, you know, to be energetic, and this is what we see. We've seen a pattern of it. I've been there for 13 years now, and I hope that he's able to get the ball rolling for safety. I really do, because if we don't feel safe, then you know that the patients aren't safe, and there's nothing worse than the feeling of going into work and not knowing that you might not make it home.
Well, I know that. And tell me, Beckett, you were assaulted. How's that going? How are you feeling?
Well, that individual's been back a couple times now. I'm feeling okay. My knee's still a little sore and tender, where there's like a bursitis that's going on from restraining the person. My eye is fine, which is great, because I was really concerned about that. I only got 2 of them, and you can't really replace them well yet. So, but I heard absolutely, our employee health call, but that's also our fellow nurses. Heard nothing from our managers, nothing from our director. It's just the hospital right now is such a hotbed of tension, and you just do not feel like you're cared for there right now, which is sad, because I've been there 13 years, as I said, and I've never seen it this bad.
Yeah, I find that it's really difficult to see when the hospital goes downhill like that, and especially when the nurses aren't included in most of the things that they should be included in. And the people that seem to be making all of these changes, like the biggest thing now is like in ICUs, they want to increase the ratio. So 1 nurse to 2 patients, or 1 nurse to 1 patient is no longer going to be accepted. It's going to be more patients. And how does that nurse take care of 3 or 4, especially during this pandemic?
Well, and even no, they can't. And we saw in our M&A president actually is an ICU nurse, and she's already spoken out against that. We saw the first surge where these patients are on so many drips. They are a 4 to 5 person turn team to turn them prone so that they can just breathe and survive. It's not one person going into these rooms. And to prone somebody, it can take up to 30 minutes with 5 people
right.
in the room, giving them flips. And now you're all gowned, you're all masked, you've got your full PPE on. And just even donning and doffing properly for one patient is about 5 minutes.
Right.
So even on the COVID floors, we've discussed, and during the first surge, our hospital worked with us, and they did, a 3-patient ratio for the COVID floors because, when we sat down and figured it out, it's about 2 hours additional a shift just to don and doff, to go into these
right.
patients' rooms. And these patients are so incredibly sick. If they're actually being hospitalized right now, they are weak, they are short of breath. We're doing high flow and BiPAP on the floors, on our cardiac floors right now, because there's just not enough beds. They're doing drips that they don't usually do. And you know what? Because we're nurses, we work with what we can and do, and we do the best that we can for our patients. But these are outside of what is normal for us also. So it increases the stress, it increases the workload, and the hospital, the second surge, is not working with us at all. There are COVID floors. Our floors have 5 patients. The resources in the past, in the first surge, did not have an assignment. They currently have an assignment. It's overwhelming. It's overwhelming at this point. We're short-staffed in the ER. We've had about 24, I think we sat down and just tried to figure it out who's left amongst the staff themselves. And it was between 24 to 29, I think it was 25 to 29 nurses have left the emergency room since January 2020. That's just a huge turnover. That's a huge turnover. Huge. They've had over 100 nurses leave our hospital. And actually our CEO just did a radio broadcast, a radio interview, and she was saying that, the M&A is perpetrating falsehoods by saying that, it's 100 people who've left. And then they just actually sent out flyers saying, well, only 58 left to go other places. Some people left for retirement. We had a lot of nurses that they didn't want to retire for another 2-3 years, but when they were furloughed or had the opportunity to furlough or retire early, they took it because they wanted to be alive for their retirement. And,
right.
They're older, the systems are more compromised, but not just that, but a lot of them saw what the hospital was doing for PPE and for how they were treating us during the first surge, and they just got disgusted. And they said, you know what, why do I have to do this for another 3 years if I can just retire now? And
right.
You can't blame them. You can't blame them. And the pace right now of keeping up with 5 COVID patients, I know that I probably at 65 won't still be in the ER because the pace will be just too much.
Right.
And same for the COVID patients, especially when you have 5 of them.
That's too much because once they're diagnosed and you know that they're ill, even in the ER, you never know when they're going to go down.
No,
it's just like anything else. You get somebody with short of breath.
Yep.
And the next thing you're doing is you're intubating them. In a heartbeat,
exactly.
You cannot leave the patients. I mean, if they want you to take 5 patients in the ER, and they're all COVID at all different stages, that is really harmful to the patients.
Well, even mix that in. Now we're in the ER. We have ICU COVID patients, regular ICU patients, COVID patients, regular cardiac and abdominal workup, and we're
right.
having we're usually about 5 to 6 patients right now. And actually, it's been so bad for staffing. As I was saying, Ms. Jackson, our CEO, was saying that we were perpetrating falsehoods and that we have adequate staffing. We've had nurses over the past weekend have to take 12 to 14 patients in an area at 3 a.m. because we aren't sufficiently staffed. And you can't just go, okay, well, I'm sorry, there's no nurse for you. Go back to the waiting room.
Right.
Oh, but
and that's what's happening, though.
and we're boarding. There's no place to put these patients. So it's not unusual for us to be boarding 10 to 20 patients a night right now. So now we have...
Where are you keeping them, Beckett? I mean, do you have a room? So all those beds are filled and you can't take in other emergencies because you're boarding patients.
That's part of the problem, is that it has gotten bad enough that we've had to, take boarding patients if they're not COVID, and then that gets to the point where, now you have cardiac patients on portable monitors, which, is better than nothing, obviously, but it's not in the central system, which is a safeguard. It doesn't, we have people in the hallways. We're taking these hospitalized patients. They're not getting any sleep, which, we feel awful for, but we have no place to put them because we need to have that central monitor. We need to have that room that has the door that can close because we know we have a COVID patient coming in. And as you said, these patients can go downhill so fast. And, they were saying during the second surge, the people aren't as sick. No, they're just as sick now. Maybe in the beginning when we started to creep up, but right now we're kind of back to the same spot where you can have somebody looking okay 1 second and you turn around and now you're watching their pulse ox drop. And they are just getting sicker and sicker. And, it's back to some interventions work, but our typical interventions that we would usually use for how these patients look don't work.
Right. Yeah,
you feel helpless.
Right. Remember the big conversation about monitor fatigue? I mean, you've got your O2 SAT machines going, you got your cardiac machines going, and then you have your patient that you have if you have 3 to 5, and some of them are COVID, and you don't know and how sick they are, and then you start hearing all those machines going. It's like,
and the call lights
what
and and that's what we're saying. With these 5 patients that are being, on the floor where they have the 5 COVID patients, we also have the DCU center right across the street, which is now a COVID open unit, right? They opened it as one of the COVID units for Massachusetts, and they take COVID patients over there, but they take the patients who aren't quite well enough to go home, but aren't truly sick. So if you're getting admitted with COVID to the hospital, you're sick. You're sick enough that we're concerned that we can't put you across the street where they still have monitors and oxygen and nurses and doctors. But it's in a big, a big auditorium, a big room. It's not a hospital. They've just set up a mini field hospital, and it's awesome that they've done this. UMass has done this with the community. It's awesome that they've done this. It's helped to relieve some of the pressure, but at the same time, if that patient is sick enough to go to the floor, and you're still giving that nurse 5 patients, now you have a patient that is so weak they need help going to the bathroom. It doesn't matter if they're 20 or 90. They're just that weak, just that sick. They need help being fed. They just don't have the energy, and you don't have fuel to help the body fight it. The body's not going to be able to fight it properly. So they need to be eating and drinking and be nourished. So now you're trying to get this person to drink. You're trying to hydrate, but you can't hydrate too aggressively with the IV fluids because then you can make them worse. So, it's just such a fine balance, but trying to get them back to a spot where they can at least start feeding themselves and getting up to the toilet, it takes time, it takes a lot of effort, and it takes a lot of nursing care. And this is something that these profit-based hospitals don't seem to understand.
No, because they don't know what you do. They truly don't. And Go ahead.
Our CEO referred to the COVID patients as, well, they're not much different than MRSA. And it just showed the lack of understanding of, how deadly this virus can be. She compared it to a COVID patient to a MRSA patient.
Well, that's her lack of education. She doesn't have an idea of what truly is going on.
No,
because that is insane. These COVID patients. Well, one of my friends, her son was in the hospital. He was one of the first COVID patients back in March. He was there for, probably 6-7 weeks. Even to this day, his ribs aren't even healed yet. He still can't walk a distance. He's still very short of breath. He can't sleep in a bed. He has to go in a recliner. This COVID is really, really bad. And he's lucky he's alive. And how, the nurses took care of him. But one of the things that she told me is that when you were talking about the fatigue that the patients feel, he couldn't even text his mother to tell her how he was feeling. So if you can't text.
Yeah.
He can't.
And here's the worst part. The worst part of that, Sheila, is that not only, so now he can't communicate with his mom, right? Because he doesn't have the energy to even do that. So it's not like you have somebody who can communicate with their family and let them know that they're okay. And it's not like their family's allowed to come into the hospital right now. We're back to no visitors. So the only way that these people are getting, that they're knowing how their loved ones are doing is by speaking to the staff at the hospital, whether it be the nurses, the secretaries, the doctors, the PAs. But our hospital thought it was in the best interest to furlough secretaries and even just not hire any. So now they're giving the resource nurses who are also have an assignment on these COVID floors phones and saying, you need to answer these. Well, I don't know about the floor because I don't work up there, but I'm going to tell you that our ER phone, it felt like it tripled in how much it rang. Just families wanting to know an update, just wanting to make sure their loved one was okay. And you can't, you understand. Like if it was my family member, I would be a nervous wreck. So you want to talk to them, but now you're running around with the 5 patients just trying to provide care. There's not enough staff. There's not enough PCAs or critical care techs on the floor. You're one nurse with 5 patients and your resource, and they're telling you to be secretary and answer the phone. Right.
And that's a real important job. But if you don't have the staff, it doesn't get done.
It's huge right now. It's huge, and it's so incredibly disheartening. It's disheartening. It's disheartening that, they might not understand the difference between MRSA and COVID, but they have to understand loving a family member and being concerned for a family member. So for them to think that this is okay, that, families can't get a hold or can't call in because we don't have somebody there at the phone, and we're too busy trying to actually take care of the person to sit there and answer phones. And it's not like I'm going to answer the phone when I'm in a COVID room or, stop what I'm doing to answer the phone because I'm trying to take care of this person who's ill. I just can't understand where they think that this is okay. They might not have the medical knowledge, but they have to have the human knowledge, that human interaction, knowing what it feels like to have a family member that's been ill or that you can't get a hold of, and it's making you give that, frantic, panicked, anxious, belly turning, are they okay? Are they alive? Are they feeling better? Are they feeling worse? And you can't do anything. You can't go in there and fluff their pillow or bring them some, their favorite food or their favorite drink or encourage them to eat. You can't do that right now. This is all so different.
The thing that you had commented on earlier, Beckett, was the downing and doffing and the time it took you. So to get back to the phone call, in order for you to pick up a telephone out at the secretary's desk to answer a question it would take you minutes, 5 minutes, 10 minutes by the time you would have to leave that patient that you don't know. You can only go in there and you have your eyes on them, and if you called out, by the time you got back there, you never know what's going on with them.
Well,
it's really tough, and there's no way. And the family, I can understand how the family could get really upset. Why can't the nurse do this? What could people do? What could the families do? If you were the CEO, would you hire more staff to just answer the phones and let them know? Have a report so that
if
the
I
families
was the CEO, I would absolutely hire more staff. I mean, it's unfortunately, I work for a company that it has a notorious reputation for putting profit over patients. And
yeah.
And, unfortunately, that's not the legacy of the St. Vincent nurses. We've always put patients over profits. We've put patients over wages. We've wanted safe staffing over wages. That's just, and that's, I just actually had I was talking to my brother and my father who are firefighters. I grew up with my father being union, my mother being union for the teachers union because she was a speech path in the school system. And, my brother said, well, why don't you just go down the street? Because there's 2 emergency rooms right within 5 minutes of my hospital. And it's the legacy. It's the legacy of being a St. Vincent's nurse and the respect and the responsibility and just knowing their history, knowing their story, knowing what they've done for patients is something that I'm proud of. And I'm still proud of it. And I'm still proud of our nurses and our PCAs and our techs and our doctors and our PAs who every day go in there, fight the fight, put on the PPE, garb up, and do everything they can for everyone they can at the expense of themselves a lot of the times.
Yes.
And they do it day in and day out, and they continue to do it despite the hospital's despicable behavior. And it's we're getting tired. And the first round of the surge, it was Nurse is a Hero, this and that and the other thing. And I hated that. I hated when people would say that. Not because I didn't feel that they meant it or anything else, but it was just, that's not how I think of myself. I think of myself as a nurse.
Right.
I've gone into the fields to help care for people, take care of people, help them to heal, and be there for them in the worst moments. And, my father and brother did the same thing. They went into firefighting. They were there for people in their worst moments. My mom helped with the after effects with stroke patients and everything else. And it's just, I come from a helping family. And I don't think that any of us consider ourselves heroes. So when people would say that to us, it always embarrassed me, I guess is the problem. It's not that I hated it, but it embarrassed me. And I don't like feeling embarrassed. I don't think anybody does.
Right.
But that respect seems to be gone again, the second surge. So on top of it, we're back to the old mentality of you have that alcoholic patient or, that patient who wants their pain medication now, screaming at you, swearing at you, getting in your face while you're trying to don your PPE to go into that COVID room.
Right.
So
right.
that first
I'm
surge
hearing that a lot.
Yeah, in that first surge where people, stayed out of the ERs, it was eerily quiet at some points where we just had COVID patients, it felt like. And unfortunately we saw that people were having heart attacks and strokes and stuff like that at home, and they weren't coming in because they were afraid of COVID. And they shouldn't be. We separate, we do everything that we can, and that just put them at greater risk, which, is sad and disheartening. But now even just our regular patients that we see more often than not, more than our families, are coming back, and the disruptive individuals that are coming back. And there's just, it's back to that. There's no respect in the society right now, and the thought processes of nurses are heroes, the doctors are heroes, the PAs, the respiratory therapists, these techs, everybody who's coming into these hospitals to do this, that's gone. That it's a forgotten memory within less than a year.
Right.
And the disrespect is back out there on top of doing this. So not only are we tired from just day in, day out, going in and having everything changed from, you take your shoes off in the parking garage at work and leave them outside your house, or you're spraying them, or you're taking little clothes off at work and coming home and changing in your garage. Everything's just so different for us that we have to take all these additional steps to make sure that we don't infect our loved ones, that we don't, bring it home, that it's just our everyday tasks are more exhausting at this point. And then you get to work and it's more exhausting. And now we're spending 12 hours in an N95 mask that, before you would go into a tuberculosis patient's room and, Ebola, and it would be a few minutes. And then you could take the mask off as soon as you left that negative pressure room. Whereas now, I walk into the ER and it's an N95 mask on unless I step outside or I'm grabbing a quick drink or, and because of that and because they're getting so sick and it's so busy, we're not hydrating enough. We're not getting breaks. We don't have enough staff to break people. They said, well, just break each other. Well, now you have 10 patients for one nurse for 30 minutes, which is just insane. I don't care if it's 3 minutes. 10 patients, that's too much for one nurse to keep track of. That's
dangerous. That really is dangerous.
So then you don't get your break. So now you're working 12 hours without a lunch break. And, it's just, or you're only taking a 5-minute lunch break. And you're shoveling something down as quick as possible, getting the water, getting the coffee, because, we all run on dunks, and and just keep going. So, we're not having the opportunity to take care of ourselves while we're taking care of all these people.
Right. I don't know, Beckett, but our time is running out, and we need to continue this. Is there anything that we can do? Oh, go ahead. You had something to say?
Well, yeah, it's fun. I think at this point we're tired. We're fatigued, as you said, not just to the alarms, but general overall. Frustration levels are high. And we still just want to take care of people.
Right.
And
however,
so for people, what can they do? They can write to the CEOs or call the CEOs of these companies and the CNOs. And, especially if your family member is in that hospital, advocate for them by phone. Tell them that you want more people on the floor, that you understand that it's a 5-to-1, or, find out what it is. You're talking to that nurse for an update. Ask her how many patients she has.
Right.
And then call the CNO and the CEO and ask them why that's acceptable.
That would be a good thing if their phones were ringing.
Yep, yeah. And you know what, but they have a secretary, because, God forbid they wouldn't have one. But you know what, if they would,
right.
And they would have to answer their own phones, oh my.
Oh yeah.
But, if they would think that was acceptable, that if their very sick family member was one of 5 patients that a nurse was taking care of, or one of 6, or one of 7, or in the ICU, if that ICU nurse had 3 to 5 patients instead of just 2. And if they would want that situation, would they want that situation for their mother, their child, their sibling, their spouse? And if they can honestly answer yes, There's no honesty in that answer.
That's right.
You know, I just, and they think that they can just throw money at the nurses. Like they just did an incentive bonus here to get people to work more shifts. And it's at the point where people are burnt out and they don't even want to work the shifts. They don't care how much money you throw at them. And it's the same thing. They don't want to talk about staffing. They just want to talk about wages, thinking that wages will fix the staffing. But I honestly, you know, Sheila, there is no amount of money that will appease my conscience or my soul if something happens to my patient, because there's not enough of me to go around.
That's right.
We're not dealing with cogs. We're not dealing with, you know, putting together a machine. These are people, and these are people's lives, and these are people's family members. And it would behoove society, but it would also, you know, definitely benefit the hospital if our management could realize, recognize, and actually treat these individuals as people.
So one of the other things in listening to your conversation is the fact that you get so exhausted, so fatigued, and then whose license is going to be suspended or gone if you make an error? When you don't have the staff, I've been there. I've certainly not for COVID, but I worked in the ER for many years, and it was like some days you can't even turn around without getting into trouble, because there's so many orders and so many things that you have to do as a nurse.
Mm-hmm. And it's not a job
really
that anybody else can do.
Right.
It's not like, you know, it's funny because you'll have the doctors come in and half the time they don't know how to work a pump, an IV pump for that medication to be given. They a lot of times they don't even have access to the med machines. So, you know, it's all stuff that has to be nurse done, nurse driven, and it's nursing care. And it does fall on us.
It is. It does.
And I wouldn't want to, I'm not downplaying our doctors and our PAs by any means, because I will tell you that in our emergency room, our doctors and our physician assistants and our techs, and even our secretaries, I mean, we have secretaries that are cross-trained as techs. They'll be answering the phones, and when we've been short, they've been getting up, they've been toileting people, getting blankets, pushing people over to CAT scan real quick. Our emergency room, even though we have been extremely short-staffed, and, you know, it shouldn't be this way, we work so well as a team, and it's such a team effort that it's amazing. I mean, we have PAs who've pushed patients over to X-ray just because they know that nurse is balls to the wall and can't stop because medications or this person's acting up and, you know, they'll pull IVs, they'll do things. And it's such a team effort in our emergency room that I absolutely, you know, I wasn't meaning to say that it was just nurses who could do this, but we have our own set of skills. I can't suture. They don't do the medications. We have our roles, but it's definitely such a team effort in the emergency room, and that's the only way an emergency room does truly work.
That's right. That's how our emergency room worked. And if it wasn't for the team effort, very little could have been done.
Exactly.
But you get the whole team together. It's just absolutely amazing. We're going to have to continue this on our next Wine and Cheese.
Absolutely.
And I'd like to somehow make sure that you're safe. And I don't know how anybody can do that, because it just seems to be getting worse and worse out there. And our other guest, as I told you earlier, had to be called in because of too many sick calls.
Yeah.
Too much was going on in her emergency room.
Well, and unfortunately, you know, they're setting us up for this by not staffing appropriately. These, you know, we're working more hours, we're working longer hours, we're working these shifts without having enough water, without having enough food, because we can't take a break because there isn't enough staff and there's nobody to protect not just like our contract, but our legally entitled right to a lunch break. that we're not doing self-care and we're getting ill. You know, as I said, our employee numbers are rising for COVID. And it's just,
I think they're rising everywhere.
Yeah. So
I don't know. It's just getting worse and worse.
I say call the management there. Ask them what the nurses are for ratios. How many COVID patients are these nurses taking care of? And then ask about the security. You know, is my family member safe? What is your security situation? Do you have a metal detector? You know, have weapons been found in the facility? What are you doing to protect my family member? Ask them the hard questions.
Right. And what do you think? The answers would be real, or can you trust them?
I think it would be real. I think it'd be real interesting. I'm not so sure it would be real.
All right. Well, let's say good night for tonight, and in a couple of weeks, depending on your schedule, we'll come back for an update.
That sounds good, Sheila. Thank you very much for having me.
Okay. And I'll say good night and thank Lillian Caldwell for the time. She's the CEO of Passionate World Talk Radio, and for Jeanne White, the station manager. Thank you both for having us on.
Thank you.